Hello, welcome to our webinar today on being a pioneer in the future of pharmacy. So today I'm going to give a little bit of an overview about pharmacy at the University of Suffolk, a little bit about what it is to be a pharmacist as a career route, and also why you should come to the University of Suffolk to study with us. So, what is a pharmacist? So pharmacists are the kind of medicine experts. So what does that really mean? So pharmacists are involved in the kind of discovery and development of new medicines, understanding how medicines work in the body, so how they're used to kind of treat different conditions. The kind of key thing is making sure that medicines are kind of safe and appropriate for the patient. So understanding the patient's conditions, making sure, for instance, that it's right for that patient, that it's the right drug for the treatment of the different conditions, that it's the right dose, that it's safe, but it will be effective, that we're using the right route in terms of how we're delivering it, and then it's being provided at the right time. And so realistically, our kind of main focus is that kind of safety and effectiveness of medicines and that being used appropriately. And we combine our kind of scientific understanding and how that kind of then underpins those clinical decisions and clinical judgments. I think what's particularly exciting is that the profession is really undergoing a massive kind of shift at the moment. So as of 2026, all pharmacists will enter the register as independent prescribers. And so this is quite a big shift in terms of kind of our roles as pharmacists. So, we are doing a lot more in terms of different things. So, for instance, making sure that like medicine that we're supporting patients with long-term conditions. So we're becoming far more enhanced clinical services. So looking after patients who have maybe been diagnosed with something, but actually in terms of monitoring their medicines on a long-term basis, looking after them, optimizing those medicines, that's part of our kind of role. And these kind of enhanced clinical consultation services is something that we really value as pharmacists. So, for instance, taking more kind of blood pressure measurements and really being involved in those kind of, I suppose, interventions and helping the patients to manage their conditions in the long term. And so, as pharmacists, we are involved in obviously providing healthcare information. So helping patients to understand how to take their medicines, what the medicines are used for, but also understanding how to manage their kind of day-to-day life and how that may kind of play a role in terms of, for instance, whether they need to change their diet to improve their kind of health for their heart. And so all of this then kind of combines in terms of making sure that the medicines are appropriate, and we're reviewing those kind of prescriptions and also prescribing ourselves to make sure that patients have the right medications. Now, actually, a lot of people may think of pharmacists and you may think of just purely the pharmacy that you see in the high street, but actually pharmacy is a really kind of versatile area for kind of careers. There's lots of different areas that pharmacists can get involved in. And I think what's really kind of special about pharmacy as a profession is that our kind of core training, so the Master of Pharmacy degree that we offer here at the University of Suffolk, provides all of the foundations for any kind of career route that you want to kind of explore. So whether that's community pharmacy, so that's working in a shop on the, for instance, a high street, helping your local community, providing services, running a business. Whether that's hospital pharmacy, so actually working on the wards, treating patients in kind of ward pharmacy, working obviously in those multidisciplinary teams with nurses and doctors and other healthcare professionals. GP pharmacy, so with pharmacists becoming prescribers, that kind of management of those long-term conditions is becoming more and more the realm of the GP pharmacist, so actually embedded within the GP practices. Pharmaceutical industry, so actually getting involved in obviously the discovery and the development of new medicines, and this is kind of obviously particularly important. Pharmacists have that holistic understanding of all the range of the process, and so therefore they can actually take part in lots of different areas of industry, from kind of manufacturing to marketing, to looking at, for instance, clinical trials design. Academic pharmacy. So myself, I'm an academic, but I was a pharmacist as well. And so actually you can go and train the next generation of pharmacists. Veterinary pharmacy. So this is possibly something that people don't realize, is that actually animals need medicines just as much as humans do. And so actually some kind of pharmacists take more of a specialty in terms of understanding how medicines can be used for animals. But this is all content that's embedded within the course. And so actually you have that kind of flexibility of going between the different sectors once you register as a pharmacist. So Army Medical Corps, so actually becoming an Army pharmacist. So you can join the Army and serve as a pharmacist. You can work in the prison service or care homes, and also, regulatory pharmacy. So looking at actually reviewing, are medicines actually safe to be released to the public? And actually, there's a whole range of different career routes that you can take with a pharmacy degree. So I suppose, what do you study? So as I've sort of, I suppose, mentioned, pharmacists are actually involved in a lot of different things, with these kind of enhancements in terms of clinical roles and consultation services. It's really important that pharmacists have that strong scientific underpinning. And so MPharm, so the Master of Pharmacy degree, is an integrated degree. And so what we do at the University of Suffolk is we teach it around 7 core disciplines. So human biological sciences, so for instance, understanding the physiology and anatomy. So it's important to obviously understand, for instance, you know, how the lungs normally work, and then how they may, for instance, how a disease may affect the lung functioning. Pharmaceutics, so that's how you take the drug and turn it into a medicine. So for instance, when you take a tablet, it's not pure drug. There is other kind of ingredients within that tablet. So understanding what else needs to go into it, understanding how we can make it, that drug, the most effective. That's the discipline of pharmaceutics. Pharmaceutical and medicinal chemistry, so understanding the structure of the drugs, how we can alter those structures in order to increase the effect, or to target specific things. Pharmacology and therapeutics, so what the drug actually does in the body. So how, for instance, when we provide a medicine, what does it actually do? What kind of receptors is it working on? How is it actually having an effect within the system? And then social, behavioural and population health. So this is probably quite a special one here at the University of Suffolk. So this is really about understanding the behaviour behind why people take medicines, or for instance, understanding what influences people's decisions about their health, and also understanding your population as a whole. So, you're serving a community, and so it's important to understand those dynamics, understand the demographics of your population, in order to tailor your services and provide the best possible outcomes and treatment for your patients. And all of that then underpins your clinical pharmacy and pharmacy practice. So clinical pharmacy is about making those informed decisions as to what medicines are appropriate for the patient, what's safe. And pharmacy practice is understanding how, as a pharmacist professional, you can operate. So the law, the ethics, but also what being a professional really is. Now, because we're obviously integrating multiple different disciplines, it is important that you have kind of strong biology and chemistry. Here at the University of Suffolk, we only require the chemistry A level, but I'll go into entry requirements in a little bit more detail later. So why come and study at the University of Suffolk? So it's a really innovative, future-facing course. So what we've done is we've really embedded a lot of those kind of enhanced clinical services throughout the course. So we're really strong on kind of training you to be future prescribers, giving you those kind of consultation skills that you need for the future of pharmacy, while also thinking about some of those emerging technologies, things that you'll be dealing with in your future practice. So whether that be kind of pharmaceutical 3D printing, or whether that be, for instance, digital services, things like wearables and apps. And I suppose what's really exciting is that the course is commencing in September 2026. So you would really be a pioneer. So you'd be the first cohort. And so you really will have the opportunity to, I suppose, shape pharmacy in the region. And so we also have 14 weeks of placement. So it's really important for, as future pharmacists to have those kind of hands-on experiences and I suppose really practice what we're teaching at the university in kind of real life sectors. So we have 14 weeks of placements across 4 years, and they're a mix of hospital pharmacy, GP pharmacy, community pharmacy, as well as an elective placement in 4th year where you can choose an area of pharmacy that you want to explore a bit more. So you really can find your kind of path for your future career. And so hopefully this gives you a lot of insight into the different career paths where you might be interested in pursuing and, help you decide on the rest of your working career. I think what's also very special, obviously, we have these integrated modules. As I mentioned, we take those 7 disciplines. And then what we do is we take an individual system. So, for instance, the heart, and we kind of weave all of those 7 disciplines together. So you really understand all the different aspects of, for instance, the diseases of the heart and the medicines involved in treating kind of those diseases. And those are those science systems and the patient modules. So you see in year 1, semester 2, year 2 and year 3, and we look at all the different kind of systems so you can understand the core underpinning science and how that applies to you as a pharmacist. In 4th year, though, what we start to do is really start to develop future kind of pharmacy leaders and get you prescribing ready. And so actually what we do in the practice leadership and prescribing readiness module is we give you the opportunity to run your own pharmacy. So in teams, you have a room in the university that's set up as a pharmacy that you would have to set up your services, get the prescriptions in and decide how you're going to handle things. You've got to run, for instance, prescribing, consultations, and so all of those different things that you would be doing in community, but obviously in the safe environment of the university. And we'll also do the same for hospital in terms of having simulated wards. And so you are the ward pharmacist. So again, you have to take that kind of responsibility and kind of, I suppose, really sort of integrate everything that you've learnt, but obviously still in that kind of safe environment. And we also have clinical rooms, so we can also do GP practice simulations as well. So that's quite an exciting, I think, aspect of the course. Finally, blended learning. So here at the University of Suffolk, we think it's really important that we give students the opportunity to learn in their own time as well as in person. So our in-person contact time is restricted between 9:30 and 4. We'll give it Wednesday afternoons will be taken off for sports, but we also will release online content. So for instance, that might be a clinical skills video to develop maybe a skill in terms of taking a blood pressure, understanding how to do that, and then coming onto campus and then implementing some of that learning in workshops. So giving that kind of mix of both in-person content and online. And so what we've also done is we've tried to think about what the kind of main priorities are in pharmacy and make sure that these are embedded throughout the course. So public health and health inequalities, so understanding how actually we can influence. As a pharmacist, we're often the first line of contact in terms of healthcare professionals. So it's really important that we kind of make those interventions in terms of public health, in terms of advice, whether that's stopping smoking, whether that's healthy eating, but also understanding, for instance, things like vaccinations, online advice about, being safe with medicines, not being misled by false information. And obviously how we can manage health inequalities by understanding our population and the dynamics of our patients. Personalized medicine. So some of you may know that we're going from an approach where we manage kind of decide on kind of medicines based on kind of data that looks at the population as a whole. And actually, we're moving towards becoming more personalized. So by understanding an individual's kind of genetics, their background, their kind of situation, we can tailor the medicine specifically for that patient instead of starting on a more general approach that may obviously have side effects or may need to be tailored. So digital health is a really important aspect for the future of pharmacy. So I'm sure you all know that things like electronic prescribing has been kind of becoming more and more mainstream in healthcare, and so aspects like ensuring students know how to use those systems, that you're familiar with them, but also that you feel confident in taking the lead in digital health in the future is something that we've kind of embedded throughout the course with kind of, for instance, workshops on providing remote consultation. So how do you do a consultation online as opposed to in person? How do you use data, for instance, from wearable technologies to provide optimized patient experience? Sustainability maybe seems a little bit of an odd one in a pharmacy course, but actually pharmaceutical waste is really it's kind of actually a really, I suppose, large cause for concern. It's something that we should all be aware of as future pharmacists in terms of, if we're recommending an inhaler, what's the propellant, for instance, doing to the environment? How can we make medicines in a more green way, so that we're not damaging our environment while we're also obviously trying to create medicines and obviously help the patient. And then prescribing. So as I've mentioned, pharmacists as of 2026 will be prescribers. So it's really important to build up those prescribing expertise, understanding of how to kind of rationalize and make those clinical judgments. And so that's something we've embedded throughout the course. So how do you become a pharmacist? Well, first of all, you need to do a Master of Pharmacy degree. So our 4-year MPharm degree here at the University of Suffolk. Once you've completed the degree, there's then a year of on-the-job training. So that's called foundation training, where you'll go out into practice and you'll have a supervisor who will obviously help to guide you through that year. And so you're learning and, I suppose, developing your skill sets. And then at the end of that year, you would then take a registration exam. If you pass that exam, subject to then meeting the GPHD requirements, for instance, on your DBS check and being fit for practice, you can then enter the register. So just as a note, foundation training, you are still obviously training at that point, so you've not actually become a pharmacist, but just as a sort of a benchmark, if you were to do that in hospital now, the salary for that is £31,000. So it is a paid position, even while you're still learning. So why come to the University of Suffolk? Well, if you haven't been here, I welcome you to come down and have a look at the university as a whole. But it's a really beautiful location. It's right on the waterfront here in Ipswich. Very modern, so kind of cutting edge facilities. And it's also, Suffolk as a county has some really beautiful kind of landscapes and things to kind of explore. So it's a really lovely place to work and study. And we are the Watch Uni University of the Year 2025 as well. So, we really prioritize student experience to ensure that you have the best time when you're at university with us. In pharmacy itself, we have fantastic facilities. So I've talked about our simulated wards. So you can see there in the top right, kind of mannequins in beds who can interact with you as you kind of gather data, to have discussions with a mannequin. And so you can really act as like the ward pharmacist in those kind of simulations. We're building brand new purpose-built labs so that you can do your kind of pharmaceutics labs and your chemistry labs. And we're building a brand new clinical skills suite as well, which has actually just been finished, so that you can practice those skills in workshops and develop that clinical know-how. So what are the entry requirements? So first of all, it's 128 UCAS points. So that's equivalent to roughly an ABB at A level. Chemistry must be one of those subjects. But we do also accept other alternative qualifications. So for instance, BTECs, access to higher education. So please do have a look on our website for more details, or contact our admissions team if you're not sure if your qualifications are suitable. Any candidate who has the right entry requirements will then be called for the multiple mini interviews. So there's a selection day where you'll come along to the campus. We'll give you a bit of an overview in terms of what it's like to study pharmacy, and how the day is going to work. And then you'll have kind of short component interviews that will look at different aspects of becoming a pharmacist, whether that be values and behaviors, whether that be, for instance, the science side of things, or how you interact with others. Just as a note, you do need to be fit to practice. It's a profession, and there are kind of professional requirements. So you do need to go through a DBS check, and there will be an occupational health check in terms of ensuring that you have the right vaccinations. So they're not part of your formal offer, but they are conditions of enrolment before you go out on practice. If there are any concerns related to any of those things, again, please do get in touch and we're happy to kind of help you navigate that process. So, be a pioneer in the future of pharmacy. So, really come and join our first MPharm cohort at the University of Suffolk. I think we're really excited to have students in September, and we'll be really kind of thrilled for you to come and join. And I suppose it's your chance to kind of shape a brand new future-facing program that's really kind of focused on preparing pharmacists on the future. It's going to be a small, supportive first cohort, so it really gives you that support and structure and build a community in terms of pharmacy. We obviously have those kind of simulated environments, so you can really practice your skills in a safe, safe, supportive area. And then obviously you're graduating ready for the kind of the modern clinical pharmacist role. You're graduating prescribing ready. This is your opportunity to come and really I suppose join pharmacy as a profession at a really exciting time, but especially us here at the University of Suffolk. So that kind of gives you a bit of an overview of what pharmacy is here at the University of Suffolk and what it is to be a pharmacist. If you do kind of have any kind of questions, I'll obviously be answering some questions now, but also do feel free to reach out to myself as Head of Pharmacy and Prescribing, or my MPharm admissions lead. There's also more information on the University of Suffolk MPharm page, as well as information from various different societies related to pharmacy. So the General Pharmaceutical Council is our regulator who kind of oversees and ensures that pharmacists are kind of fit for practice and suitable for the register. The Royal Pharmaceutical Society is kind of the professional body that represents pharmacists, and they have lots of information about different career paths and how to study pharmacy. And the British Pharmaceutical Students Association is the society for students across the UK. And again, they have lots of information about studying pharmacy. So, does anyone have any questions? So I suppose while everyone's kind of thinking of their questions, I thought maybe I would give you a bit of an overview about my kind of career as a pharmacist. So that might be interesting to some of you. So I actually trained as a pharmacist, and I decided that I would actually start off in industry. And so I went and I worked in formulation, so obviously developing medicines, and that really, I suppose, highlights some of the strengths of pharmacy, in the sense that what I was doing was kind of working in a team with, for instance, kind of manufacturing engineers. But obviously, as pharmacists, we understand the process of how to make the medicines, so we can communicate about the kind of manufacturing side of things. We can talk to, for instance, the analytical chemists in terms of impurities, for instance, in the product, or how the stability of the product and what we need to think about. We can talk to our kind of, packaging scientists in terms of what packaging do we need? How can we, tune it to be fit for purpose for the patient? And obviously we can, start to have an input in terms of the clinical trial design, as all of these are skills that pharmacists develop as part of the MPharm course, and it's things that we actually can kind of, I suppose, be that bridge between the different professions. And then I decided that actually I would become an academic pharmacist, and so be able to teach kind of the next generation. And I think that's what I think is very special about pharmacy as a profession, in the sense that actually the MPharm course gives you all of those foundational abilities to go into the different sectors, whether that be hospital, community, GP, industry. And so, unlike other kind of healthcare professional courses where you may then need to do kind of a specialism, actually, uh, we have all of that kind of foundational knowledge in the degree itself, and obviously when then you do your foundation training, which means that you can change between sectors. You've got that kind of versatility in your career, and I think, you know, a lot of pharmacists really appreciate that kind of option to kind of transfer between things. And I think it's, you know, it's a very exciting kind of profession to be involved in. And I think actually these new changes of becoming far more clinical, pharmacists becoming prescribers, is going to be a really exciting time for our profession, you know, over the next few years. And actually, it's going to be a really exciting time, I think, to become a student. And to find out about how the profession is changing and what's going to happen in the future. So, you know, I really think that now is a great time to study pharmacy, and obviously I hope that you'll come study pharmacy here at the University of Suffolk. If you are interested in applying, please do reach out to our admissions team. We can obviously give you kind of more information about studying pharmacy, or you can apply through UCAS, and we'll obviously then send you the invite for interviews should you meet the kind of entry requirements, and so then you can obviously come study at the University of Suffolk in our initial cohort. So obviously, if anyone does have any questions, then, you know, do feel free to put it in the chat. I think in terms of kind of preparing for pharmacy, so I know that I kind of had a question today about what do you need in order to prepare for a pharmacy degree. So we don't kind of mandate work experience, but I would really recommend, even if it's just a day, just to get an insight into what pharmacy is as a profession will really help you prepare for the interview. But also, I think, understand that pharmacy really is what you want to do, kind of moving forward. So, you know, whether that's right to your local hospitals, so there'll be a kind of an education training lead for pharmacists, and you know, they're usually happy to organize a day where you can go round, you know, follow a pharmacist, understand a bit more about the role. You know, whether that's going into your local community pharmacy and asking if you can spend a day just to kind of observe and learn a bit more about what goes on within a pharmacy. As I think it surprises people, I think a lot of people's kind of perceptions is that it's sort of just handing out the box, but actually the checks that have to go into making sure the medicine is safe. You know, first of all, is it legal? Can we actually provide that medicine? But then, is it right for that patient, you know, with the different conditions they may have, the interactions between it with their other medicines? Have we considered all the different aspects, you know, in terms of that particular patient's needs? And so that kind of clinical check is really important. It's something that pharmacists, I suppose, specialize in terms of really understanding all of the different aspects that go into whether that medicine is suitable. And so you know, I would highly recommend you to go and, you know, get a day or a couple of days, just to sort of see what's actually happening, see the role of the pharmacist, and, you know, why pharmacists are actually so important for healthcare, actually across the UK. You know, and some GP practices are also offering, you know, days as well. So it's not needed. So it's not mandatory, I suppose, but I think it really helps to give you an insight into the profession, and that will help you with your interviews and help you to provide answers that kind of, I suppose, gives you that insight as to why you're studying pharmacy, but also to help you to demonstrate that kind of passion for the profession. I think the other thing I would really recommend is we have a lot of information on our website. So, we have the University of Suffolk MPharm video. We have information about obviously our course design. I mean, you've made a great step coming today, but actually you can go and read up a bit more about the different aspects of our course. And so all of those things will really help come the interview so that you can turn up and be knowledgeable about why, for instance, you're interested in pharmacy, what aspects of the course really interest you. And then I think apart from that, it's, exploring the profession a bit more. So having a look, for instance, the Royal Pharmaceutical Society, as part of the pre-interview, will send you through the standards for pharmacy professionals. But it's important that you kind of, read through those, think about how it applies to you, think about actually what it means to be a professional and, to be a pharmacist. All of those things will help you in kind of preparing kind of for the interview. And I think, you know, if you kind of come and you show that passion on the selection day, that makes such a big difference in terms of, that interview process. Because if you understand pharmacy, and you understand why you want to study it, that can really help to kind of, I suppose, give you that, extra edge on the selection day. And I think also just, think about the patient is the one thing I would say. So for pharmacists, patients are at the center of everything we do. And I think sometimes it can be easy to kind of forget that, and focus on, oh well, I'm doing chemistry A level, or this is what I'm doing kind of in my day-to-day life. But actually have a think about, well, what you're doing and how would that make you a better pharmacist, and how would that mean that you could better support patients. And I think once you start to develop that kind of mindset and understanding that actually patients are at the center of everything we do, that will really kind of help in terms of the selection day as well. But ask questions. That's why obviously we run these webinars, but also it's why we have an excellent admissions team here at the University of Suffolk, and obviously we have the pharmacy team as well. So we're really kind of happy to answer any questions, and to kind of guide people if they're not sure. If you, for instance, if your qualifications aren't necessarily right, or if there's anything that you're not sure about the course, it's best that you know exactly what you're signing up for, so that you've got that kind of passion, to become a future pharmacist. And so we are happy to help in any way we can. Okay, so I don't think there's currently any questions. So what I'll probably do is I'll bring it to a close. But I just wanted to thank you all for coming, and thank you for your attention. I hope you found that really insightful, in terms of what pharmacy is as a profession, but also why you should come and be a pioneer with us at the University of Suffolk. And so I look forward to hopefully seeing you in our September 2026 inaugural cohort. Thank you so much for listening.